Hello guys, welcome back, and today we will discuss about nursing care plan formulation or how to develop a nursing care plan. In the last video we had a discussion regarding how to formulate a nursing diagnosis, and here we will see how to write a nursing care plan, a good nursing care plan. So what is nursing care plan? Nursing care plan is the written record of action plan which is also discussed with the patient and his family or her family to meet the needs of the patient. So it is a written record of the action plan, what we gonna do for the patient, okay, and what we are going to do to improve the condition of the patient. So that things we are writing in a written form means that is known as nursing care plan. It is the written record of the action plan which is also discussed with the patient or the family to meet the needs of the patient. Then while coming to the components of nursing care plan, first component is assessment, second is diagnosis, third is goal, planning, implementation, evaluation. So these are all the components of nursing care plan. So these components are very important while writing these nursing care plan. Definitely you have to write all these components. Now we will see detailing what is each component. So first thing is assessment. Assessment means collecting and analyzing data to understand the needs of the patient. So in assessment, we are collecting or gathering all the information which is necessary to create or develop or formulate a nursing diagnosis, as well as to plan the care for the patient to meet his or her needs. So first component is assessment. Second thing is diagnosis. In the last video, we had a detailed discussion about this diagnosis. So what is diagnosis? It is a clinical judgment based on the assessment. It is a clinical judgment based on the assessment to plan the future things. Next is planning. Planning means it is a short-term and long-term goal planning based on the assessment and diagnosis. So in the planning session, we will plan each and everything. So what we gonna do for the patient to make the patient to come back to the normal level. So planning is based on the diagnosis and assessment. So what we can see here, each component of this nursing care plans are interrelated. Next thing is implementation. After planning, what we will do, we will implement. Implement means we will execute each plans to meet the needs of the patient. After implementation, what we will do? Evaluations. Why we are doing evaluation? Evaluation will help to understand the effectiveness of each plan. If the plans are not effectiveness, we have to modify the plan. Okay, so evaluation will help for modification of the plan or to understand the effectiveness of each and every plan. So these are all the components of nursing care plan: assessment, diagnosis, planning, implementation, evaluation. Next thing is a good care plan must include. If you are writing a care plan, that care plan must include all these things. First thing is why we are doing it. What is the need of this thing? Then what we are planning. What is the plan? It should be specific. What would be the outcome? What is the end result and what is the end result you are expecting? Then who is going to implement it? Okay, who is either a nurse or healthcare professional or any other healthcare professional? Then when it will perform, in what time? Morning, evening, time, what is the time limit? Then where it will perform, either in the hospital or in the nursing home or in the community setup or in the care home or in the rehabilitation center, where it will perform. So these are all the things you have to include in a good nursing care plan. And what is the smart approach in nursing care plan? Okay, S means specific, M means measurable, A means achievable, R means relevant, T means time limited. So a good nursing care plan need to follow this approach. Specific. It should be specific. It must be measurable. It must be achievable, like means achievable. Targets need to be achieved. Then only you can get the result. Then relevant. It should be relevant for the patient's needs. Okay. Patient needed a particular thing means you have to plan for the particular things, and it should not be irrelevant. Then time limited. A specific time limited. It should not be go for 1 year, 2 year, 3 year. The patient is having breathing difficulty means you have to plan for 8 hours or one day. then only you can get the result as soon as possible, then only you can provide proper care to the patient, and effectively we can plan, effectively we can provide the care. So it should be time limited. So this is the smart approach in a care plan. It must be specific, it must be measurable, achievable, relevant, and time limited or time bound. Next, what is the need of a nursing care plan? Okay, from the so far we had a discussion regarding what is nursing care plan, components of nursing care plan, etc., etc. Now we will see what is the need of a nursing care plan. To individualize the patient care, to provide individualized specific care, because each patient is unique. Then to think critically about the needs of the patients. Okay, once we plan only, we will critically think about the situation of the patient. Then to provide continuity of care or continuing care, to maintain interprofessional collaboration. So when we plan something, when we plan the care, we'll discuss your plan with other department people, those who are in the healthcare setup. So it will helps to improve, or it will helps to maintain an interprofessional collaboration that will be very useful for the what effective, useful for effective care. Then to focus on patient-centered care, to make the patients to engage in care plan. So once we plan the care, we will engage, or we will include, or we will indulge the patients also in the planning. That will definitely helps to improve the condition of the patient. Then to evaluate the effectiveness of each intervention. So these are all the needs of a nursing care plan. Next we will see what is the format of a nursing care plan. So this is the format you have to write while writing a student nursing care plan. Okay, so this is the format. First column assessment, second diagnosis, that means Nanda International Diagnosis, third is planning, fourth is rational, fifth is implementation, and sixth is evaluation. So first column is assessment. Guys, this is very important. This format you have to follow, and this is the format for nursing care plan. So first column is assessment. Under assessment, two headings you have to write. First heading is subjective data and second heading is objective data. What is subjective data means? What the patient is saying about their condition. That is subjective data. Patient complains that the patient is having cough, patient is having dullness, patient is having breathing difficulty. What the patient saying, that is subjective. What the subject is saying, that is subjective. Second is objective data. Objective means what you are observing. Patient looks dull and tired, patient looks weak. So what you are observing, that is objective data. For you, patient is an object, right? So objective data. So that is the first column. Then we will go to next column. That is diagnosis. That is Nanda International Diagnosis. That format only you have to follow while writing the nursing diagnosis. Please watch the previous video, then you will understand how to write nursing diagnosis. That means Nanda International Nursing Diagnosis. That the nursing diagnosis you have to write or you have to write the nursing diagnosis based on Nanda's regulations. Okay, and what is Nanda, an expansion of Nanda, everything you can see in the previous video. Then after writing the nursing diagnosis, you have to write one more heading in that, that is goal or objective. What is the goal of this nursing care plan? The patient will obtain normal airway clearance, or to overcome the patient's breathing difficulty. Either you can write goal or you can write objective. Then after that you have to go to the third column, that is planning. In the planning you have to plan everything: assess, check, monitor, administer, depends. Okay, then you will write the rational. Rational is the continuation of planning. For what is the need of each plan, that you have to write in rational. Assess, to understand, check, to know, monitor, to evaluate. So whatever the things you have to write, then that two, that word is important. Okay, two. Okay, then after that you have to write the next column, that is implementation. In implementation you have to write in the past tense. Assess, assessed, check, checked, monitor, monitored, administer, administered, reduce, reduced. Okay, and after implementation go to evaluation column. In the evaluation column you will get a result, so you can write the patient improved, the patient is able to, the patient was maintained. So that also you have to write in the past tense. So this is the format of nursing care plan. Again telling you guys, this is the format you have to follow, including Nanda International Diagnosis and that format: assessment, diagnosis, planning, rational, implementation, evaluation. So this is the format. Under assessment, subjective data and objective data. In the diagnosis column, again two more headings will come. First is nursing diagnosis, second is goal or objective. Okay, and this is a what example for the nursing care plan, a good nursing care plan. If you follow this format, you will get a good nursing care plan. So this is a format. I told you assessment, two headings will be there, subjective data and objective data. So what is the subjective data? What the patient says about his condition. Okay, the patient says that he is having difficulty in breathing and cough since 2 days. What is objective data? What you are observing. The nurse observed that the patient looks dull and tired. So that is the first column. Next is diagnosis. Okay, this is Nanda International Diagnosis. Okay, ineffective airway clearance related to bronchial inflammation as evidenced by coughing dyspnea. So this related to as evidenced by these words you have to add. Okay, this is the three-part statement. Okay, two-part statement also is there. This is a three-part. Basically we are using this three-part statement only for a nursing care plan. I mean student nursing care plan. Next you have to write the heading goal. Under goal you have to write in future tense. The patient will obtain normal breathing pattern by keeping patient's airway clearing. The patient will obtain. Okay, then you have to plan the thing. So the patient is having ineffective airway clearance, right? The patient is having breathing difficulty. Okay, use your sense and write the plans. Okay, collect the history. Assess the rhythm and rate of respiration. Monitor the chest movement. Okay, elevate the head position. Change the position. So after writing that, you have to write the rationale for each plan. Collect the history. For what? To understand the situation. Assess the rhythm, rate, depth of the condition. To understand the breathing pattern. Okay. And then elevate the head of the bed. For what? To improve the beating. Then change the position to reduce the discomfort. Okay. So that you have to write in the rational column. So what you are planning, what is the need of that plan, that you have to write in a rational. Then after rational, implement. That means you are implementing, executing. Collect the history, you collected. Assess the thing, assessed. Monitor the chest movement, monitored. Elevated the head, elevated. Change the position, changed. Do section, did section. Okay guys, so like that you have to write the implementation, and at last you have to write the evaluation. In evaluation you got a result. That result you have to write. After the intervention, the patient was able to maintain the patient's airway with breath sound, and the patient maintained breathing pattern by clearing the secretion. So in the future tense you got the result, and if you got the result, means what the result you got, that you have to write. If you didn't get a proper result, that you have to write here, and you have to write what you have to write. You have to write, you need to remodify the plan, you have to plan again, you have to change the plans. Okay guys, so this is the format you have to follow while writing a nursing care plan. Go through this. This is a good example, and follow this and write the nursing care plans based on the condition of the patient. Okay guys, hope you understand. So this is nursing care plan. So before going to read this one or listen this one, go through the nursing diagnosis video. How to write nursing diagnosis, that is very very important. If you write a proper nursing diagnosis only, you can create or formulate a proper nursing care plan. Hope you understand guys. Thank you.